Thank you all for being here. Number one, I think this is going to be a lot of fun with a lot of information. And so what we're talking about here, just so everybody makes sure they're in the right area, Your Gut, An Owner's Guide to a Happier, Healthier Belly with Austin Chiang. He's the author of this. And before we introduce Austin Chiang, I just want to let you know this is his book right here. It's called Gut, An Owner's Guide. We're going to do what we can in the next 50 minutes to digest as much of this as we can, okay? We're gonna. I don't want to feed you a lot of information, so we'll get it from him. And I love dad jokes, so forgive me for those. I hope everybody can stomach that. So let's just go ahead. So Austin, I think that's it. That's my whole repertoire. Just tell us a little about yourself. We'll get into the book in a bit.
I am an interventional gastroenterologist by training. I have a dual role, so I'm part-time clinical at an academic center in Philadelphia, but I'm also full-time at Medtronic as Chief Medical Officer of the endoscopy business as well. So I kind of have a hand in both, teaching and patient care, but also in the development of innovation in the gastrointestinal space as well.
So before we get into the questions I have here, I'm going to let you know, partway through this, we're going to talk about myths that people have concerning their gut, their stomach in particular. So I'm going to open up to the audience just to hear any myths you might have and have him bust those myths or confirm the myths, depending on which ones they are. But first, let's start with this. How did this book come about? Because this is typically something we don't talk about. There's a lot of things, people talk about their heart problems, their brain, and all sorts of stuff. They typically don't talk about their gut.
Yeah, it's interesting. I feel like it's such a stigmatized area. We don't talk about guts and butts enough. And really, we really should, because, just like any other organ out there, like our elbow or our thumb, it's something we've got to take care of, right? And I've been speaking about GI health, gut health on social media for years and years now, because I always felt like there was a lot of misinformation. We just came from a misinformation panel that I was on, and there's a lot of gut health myths and misperceptions being perpetuated online. And so I felt the need to put myself out there and talk about gut health in a way that was digestible and trying to distill down very complex ideas into something that was easy to understand. And so I was approached by this publisher, DK, one of the Penguin Random House publishing companies, to write a book, which is actually part of a series of 4 different books. There's also a breast book and a heart book and a brain book, and probably more to come. And so when they approached me with the idea and the fact that it's an illustrated, colorful book, I was game. So,
big question here. You mentioned this, but why don't we talk more about our gut? It is one of the things that occupies us throughout the day. We're constantly thinking about it, and especially if things aren't going as well as they could be going, you tend to focus on that a lot. But why don't we talk more about it?
Right. I mean, you bring up a really good point, because I say that everyone in this room has had gut health issues, whether or not you realize it. If you ever had an episode of nausea or diarrhea, your gut has malfunctioned at one point or another. And I think the reason why we don't talk about it more is just we have a misperception of the gut just being this tube of where food enters through one end and then it comes out the other end. But actually it's a very complicated system. There's other organs involved, not just the colon or the intestine, but our stomach, our esophagus, the liver, the pancreas. All this falls under the umbrella of study of gastrointestinal health. And then on top of that, there's also the invisible conditions that fall into our field of study, like obesity and the gut microbiome. And I think there's just been a lot of confusion around this over time, and we're just starting to scratch the surface. So there's still a lot more that we need to figure out.
And as a specialist who specializes in the gut, endoscopy and those things, do you find that your patients also are a bit reluctant to talk about some of these issues, that there might be some aspects that you kind of have to pull out of them and say, tell me more about this certain part?
Yeah, I think culturally, some groups out there probably don't want to talk about their guts or butts, and that's totally understandable. And I think that, we just have to overcome some of that stigma.
You and I talked before this, just to get an understanding of each other and what we're going to talk about here. One of the things you brought up was kind of the history of the gut, and the history of gut as it pertains to our understanding of it. Walk through some of that.
Yeah, so I think that, at least from a gastroenterologist perspective, a lot of what we do now is technology-driven, and our ability to look within the gut, it has evolved over time because the technology has only gotten better and better, but at one point we didn't have the ability to look in the gut, to investigate it, the way we have. And it's really only been the past few decades, probably 40, 50 years or so, that we've gained a better understanding of it and had ways to actually investigate it further. But before that, we kind of relied on other ideas or theories, and over time, a lot of those theories have remained, and others, we've debunked.
And getting kind of to the overall concerns that a lot of people have, what's the best thing we can do for our gut?
Ooh, that's a.
Oh, well, first let's define gut. Let's define
Yes.
gut, because we talk about what you talked about, beginning to the end.
Right.
Are we talking mouth, esophagus, all the way down?
Yes, absolutely. So it really depends on what part of the gut we're talking about. When people come to me and say, "What can I do to have a better gut?" Are you trying to lose weight? Are you trying to prevent cancer? Like, what is it exactly? Are you focused on the liver? Are you focused on the pancreas? What is it that we're getting?
So it's not just the intestinal system.
Right, exactly.
You're talking even outside the intestinal
Yeah.
system.
So generally speaking, I think that one thing that we all have control over is what we are able to get screened. And there are clear screening recommendations out there laid out by the government based on evidence, like getting a colonoscopy starting at age 45 if you're average risk. Everyone in here needs to get screened for colorectal cancer at some point in your lives. So starting at age 45, if you don't have any underlying medical conditions or any family history, those are types of things that we actually have control over. And during the opening session when Francis Collins brought up Hep C, I thought that was a really good call out as well. We have basically a cure for a condition that's affecting millions of people, and people are still not getting, the message isn't getting out there. There's still a lot of barriers that have to be addressed, but there are solutions for a lot of the problems out there that we have.
And do you find certain populations take better care of their gut? Certain populations here in the country, or certain populations in certain countries that seem to take better care of themselves and their gut?
I think it depends. I think sometimes it's a double-edged sword. People who have more resources and have access to information sometimes can access problematic information, and might be seeking out expensive treatments that actually aren't providing much benefit. So it really depends. And you're right. When we look at the global population, gut health conditions and concerns vary from country to country. So the recommendations that hold true here are very different than what you see in Japan or in the Middle East. And so it really depends on where you live.
Now, one thing we found out, and I found out through my own medical education as well, is things that we didn't even think about decades ago are how important our gut health is to other parts of our body, particularly gut-mind, gut inflammation, these types of things. Talk about that and what we know, what we didn't know before and what we do know now.
Yeah, so it's interesting. I think for the longest time through medical training, we've been taught that a lot of these GI conditions, or like liver disease or pancreatic disorders, manifest in different ways. We can see it in eye pathology and skin conditions. And so there's clearly a link between the gut and other systems within the body. And to your point about the gut-mind connection, I think there's a lot of buzz around this. And there's actually a certain category of conditions called the gut-brain, disorders of gut-brain interaction. So IBS, irritable bowel syndrome, is one of those conditions that affects millions of people, and it falls under that category. But we're still just starting to understand what that's about. And there seems to be this bi-directional connection where not only does the gut somehow affect your mind, but stress and other mental health conditions can also potentially affect your gut and lead to inflammation and whatnot as well. But how to really harness that and influence it in a way that's meaningful to treat certain conditions, we really don't have any idea yet.
And how important is it to get your gut under control, to say, and to get it as healthy as possible for these other parts of your body?
Yeah, I think that if we can optimize the condition of any of these organs, then we can, it will lead to the optimal health that we have, and we'd be able to live to our fullest potentials as a result. So if you can imagine, like, even all of us, like I mentioned, nausea, diarrhea, constipation, some of those most common symptoms, if you go through your day experiencing any one of those, it can really impact how you go about leading your life. And imagine people who are dealing with symptoms like that day in and day out. It can really take a toll on you.
And we brought this up a little bit earlier, but I didn't ask the full question. What's the best diet for people for their gut? And you had mentioned it depends.
Yeah, it really depends. Obviously, a lot of people have very different dietary restrictions, access to foods, other constraints. I would say, I try to simplify things as much as possible and just say that it should be as diverse as possible within, whatever dietary constraints that you have. But it should be diverse, it should be high in fiber, and it depends on what your goals are. Again, depending on if you are looking to lose weight, that type of a diet might not look the same as somebody who's trying to achieve a different goal. And so some of the patients who are coming to me with weight loss concerns, for instance, there are certain foods that are branded as healthy, and they are healthy, but they won't help you achieve that goal because they're very, caloric dense and whatnot. So it really depends.
And then something that's really come to the forefront over the last decade or probably 2 decades, microbiomes. Mm-hmm. And looking at our gut microbiomes and how important that is to not just our gut health, but our body health as well. What are we missing there?
So it's interesting, the gut microbiome is this big overarching term, right, of just bacteria in our gut. And once again, there's different segments of our gut that we're talking about. There's bacteria in the stomach that we know can potentially cause cancer. H. pylori is a very common, bacteria out there around the world. And certain populations are at greater risk of that. And it's very interesting because it's changed the entire idea of how a bacteria can potentially cause cancer. It's a linkage that, before this bacteria, we didn't really think that that could happen. But then I think what you're referring to is also the microbial populations in the colon. And that aspect of it, I hate to disappoint everyone in here, but I feel like we don't know much about it, and there are very, very few recommendations as to what supplements or probiotics take and when to take them, and partly because we don't know which strains are the most useful, what dosages, what duration of treatment you should be taking these for. And the thing is, all of us have our own kind of gut microbiome population, and it evolves over time as well. I don't know if anyone realized that, but
so it changes as we age.
As we age, absolutely. So it depends on where you are in life. And so again, to actually deliver a therapy that's microbiome based, I think we have a ways to go to figure that out.
So when it comes to your microbiome, it depends on a lot of things, and correct me if I'm wrong, but it depends on where you grew up, the environment you grew up in, where you're living now, how old you are, what your diet is. I mean, there's a variety of things here. So when they do the one-size-fits-all, take these microbiomes, these probiotics and things to help you, might not be the best answer?
Exactly. So the one takeaway is that often our approach to medicine should be very personalized. And what's unfortunate is that a lot of the recommendations out there or treatments that are being marketed to you all are all one size fits all. But yeah, that's absolutely true. Is that it kind of has to be tailored a little bit better.
What about probiotics? We brought those up. Should people be using them? Should they not be using them? Because it depends on what time of what year it is. But sometimes it's all the rage. Sometimes it's not as much.
Yeah. So the evidence is very premature. And even in the conditions where it is generally recommended by our professional societies, that evidence is still pretty weak, but there's very, very few situations where probiotics are actually recommended. That's not to say that they're not helpful. There's some people who, there's obviously a lot of probiotic supplements that are sold in drugstores and whatnot, and some people actually do find symptomatic benefit from that. But there's also people who take those probiotics and actually feel worse, and there's no great way to predict whether or not, what sort of kind of outcome there's going to be. And the thing is, a lot of these supplements aren't regulated the way medications are by the FDA, so there may be other additives that could be potentially harmful that we don't know about. We don't know about the effects of those until, who knows, years, decades down the road.
So could those probiotics change our microbiome in a not good way?
Yes.
Is that possible? So do you need to have caution when you're taking these?
Absolutely. So I would definitely recommend that you speak to your physician before taking some of these probiotics, especially if you have an underlying medical condition like an autoimmune disorder, or if you're on certain medications where you might be more susceptible to some of these harmful effects of these live bacterial cultures.
And speaking of which, IBS, Crohn's disease, those types of diseases, probiotics, can they be helpful in those situations, or should patients be avoiding those?
They're
it depends.
Currently being investigated. There's many, many trials around this, and so I think there is promise around that. I think it's hard to say. Right now what's available on the market, these probiotic supplements are sometimes multiple strains of bacteria. I think the hope is that one day we get to a point where we can actually isolate what it is within the bacteria to be able to deliver treatment for an IBS or a Crohn's disease, but we're not there yet.
When it comes to our microbiome and how much sometimes it gets focused on, Is that something that we should be concerned with? Is that something that we should just be eating a healthy diet to make sure that we get what we need out of that?
I think we should. Again, there's not a great way to predict, a great diet that will lead to the best sort of gut health outcome. But, we also live in this society, in this world where so much is ultra processed, and, the more you can keep it, away from that, I think the better.
And we were talking about diets earlier, and then the diet that would work really well. What are the mistakes people make when it comes to their diet and their gut health?
Ooh, mistakes that people make. I would say just not fully understanding what they are putting into their bodies. Again, there's so much that you just buy from the store and blindly, prepare without actually looking into what the ingredients are and what it is that you're putting in your body. And I get it, it's difficult, right? We're all busy people, and people have to, that's just what some people rely on. But I think having greater awareness around what exactly we are putting into our bodies is a big help.
The main thing, and does that mean, there's always that debate going on about, sugar, carbs versus fatty diets kind of thing. Does that affect our gut as well as our cardiovascular health, which we know it can affect it?
Yeah, absolutely. I mean, I think that, remember, there was this whole idea of how fats were bad a while back, and as evidence emerged, we realized that that's not entirely true. And so I feel like everything, we need all of the macro and micronutrients that we know of. We just need them in the appropriate proportions. And which is why I think at the end of the day, I just encourage a diverse diet as the main recommendation, because that way you can make sure that if you're isolating entire food groups, for instance, you might be missing out on some of these important nutrients that you may otherwise be getting.
And now, looking at, you brought this up earlier, some of the screenings that are out there, especially colorectal cancer screening. There's the colonoscopy you can get, the Cologuard you can get, the blood stool tests you can get. Where do you stand on those?
Where I stand is that the gold standard is still a colonoscopy, just because we're able to locate things early, and that's the whole point of kind of getting screened, right, is detecting things early and being able to remove it on the spot. A lot of people might not be able to get colonoscopies or a procedure for a lot of different reasons, and I understand that. And that's when you may want a non-invasive test, but those tests often don't tell you exactly where it is, don't catch things early, don't allow you the ability to actually remove the thing early. And so that's why colonoscopy ultimately is still the gold standard.
And why do you think we're seeing a reduction in the age of people that are getting colon cancer, basically? Because now they're starting to reduce the age for colon cancer screening because of that.
Yeah, that's the billion-dollar question, I think, is that we're seeing, an increase of 2 to 3% per year among young adults less than age 50, and by 2030, it's going to be the #1 cause of cancer deaths in that age group. And it's really concerning. We don't know why. And the best we can say is it's probably something environmental. It's probably something related to our diet. But what exactly is it? And we're evaluating. I think one of the cautions that I try to point out is that we often evaluate the science based on what things are like today. But the effects often are probably from, again, decades ago. People who fall into that age group. Back then, we were probably eating different things. Things were regulated differently. So who knows exactly what it is, and it's hard to parse out, is it one cause, is it multifactorial? I think there's so much that plays into it.
But regardless of the cause, the screening's important.
Yes, because that's the one thing that we actually have control over.
Do you find that your patients have a misunderstanding of the gut? They understand fairly well when they come in?
I wouldn't say a misunderstanding. I think a curiosity, and it's a gray area. Part of, again, there's a lot of emerging evidence, and it's gray because we don't quite understand it, and that's also why there's a lot of, misinformation out there, is because people like to fill in those gray areas and capitalize on people's lack of understanding in those areas.
And I definitely want to get to the misinformation part of it, but also want to open up again, like I talked about, myth busting. You agreed beforehand, you do some myth busting. Anybody have any myths they've heard about the stomach or the gut, the intestine?
All right, so I have 3 kids. They're grown now. When they were young, multiple food intolerances, stuff flying out of both ends with force. As things seemed to get under control, they were using the toilet. They had a lot of floaters, and I was told that if you have floaters, it means you're not properly digesting the fats.
Is that true?
So that's a great idea.
You actually bring that up in your book. That's one of the things.
Yeah, so I mean, yes, to a certain extent, fat content can, affect whether or not your poop floats, but that's not the only cause.
You
right?
never
Sometimes-
thought you'd hear that, did you?
Sometimes it's air, sometimes it's other things, so it's not always the cause, but it's one potential thing. And of course, without seeing it, it's hard to say. Often, like fatty, greasy stools can actually, so when we actually think about like a pathological state of too much fat or fat not being absorbed and actually just coming out you the other end, it's not just that it floats, but we also actually see greasy residue, like toilets are hard to clean, like that's often what we think about. Yeah, so if that's the case, then maybe to a certain extent.
Okay.
Yeah.
Did you have one?
I'm just curious in regards to,
A lot of the stereotypes out there in regards to, Tums and Pepto and these type of over-the-counter medications that you just kind of self-medicate. Does that actually help, or is there another course of action you would recommend more for biomes?
That's a great question. It really depends on what we're trying to treat, right? So like for Tums, for instance, that's an antacid, so it just neutralizes the acid in your stomach. And so if people are occasionally getting acid reflux symptoms, that is an okay way of treating it. And there's plenty of other medications over the counter, like Pepcid and Nexium, all these, they have slightly different mechanisms. And it really depends. You should have a conversation with your doctor just to make sure that you're on the right one. But actually, a lot of the professional recommendations are actually that you start with a medication because these conditions are so common. It's often like a burden on our health system to just go ahead and go through a bunch of diagnostic testing. So the recommendation actually is to try a medication like a Pepcid or omeprazole or like one of these Prilosec medications for 8 weeks, and then if it doesn't resolve, then go see your doctor. But it really depends on an individual basis. Yeah.
And on that question, one of the things I was always taught in medical school is that if it comes to constipation, if you're on a constipation medication, that should be a short-term thing, not a long-term thing, because if it turns long-term, then your intestine gets used to that and you have a harder time with it.
Actually, this is a great point, is that a lot of these medications shouldn't necessarily be lifelong medications. So some of these over-the-counter medications, sometimes I see people stay on them like forever, and really the goal should be to get them off of it. And if you can't get people off these medications, then there needs to be more testing involved. For this type of situation, it depends on what.
I'm asking for a friend.
Some medications are actually more harmful than not to take long term, and it's not that you develop a dependency on it as much as the medication it's a phenomenon called tachyphylaxis. It just loses its effect over time. And so you find yourself taking this medication over and over with no effect at all.
So at what point should you say, I need to see somebody?
I would say as soon as possible, because you never know what your symptoms are. It could be something else. Often we think, oh, constipation, diarrhea, no big deal. But sometimes, and we all have our own definitions of what those are, right? Like if you ask everyone in here what diarrhea is, sometimes it could be like water, sometimes it's just looser stools, and when we see this all the time, and sometimes that can actually signal something more serious. So I would say, when in doubt, if it's something that's persistent, if it's not something that just resolved after a day or two, then you should definitely see someone.
Any other myths out there?
Yes.
Right? And I'd love to hear your perspective on this, because almost everybody I know on this medication, they're no longer regular. They're like, well, I don't poop anymore. And so I would love to hear your perspective on this.
Yeah, so GLP-1 agonists.
Just real quick, so I understand the question, so that people can understand. So on a GLP-1, you're hearing from people that they're not.
Yeah. Well, it's literally, that is the mechanism of action, is it slows down the gut. Yes.
Is that?
What is the slowing down digestion doing with the microbiome? I'd love to hear your perspective, because we don't hear that side.
I think this is a challenge, is that GLP-1s haven't been out long enough for us to truly understand, and run studies to be able to, conclusively say what effect it has on the microbiome. But it's absolutely true that it slows the gut down. So chances are there might be some sort of effect on the microbiome, but we have to see. Yeah, but GLP-1s, it's definitely affecting our field in a lot of different ways. Because, if you think about people who are getting procedures like endoscopies, we often have to, be very careful because there might be food in their stomach still when we go down, and it's like a whole conversation in our field for sure. Well, for an endoscopy, when we're actually going through the mouth and into the stomach, we often have to recommend now, there's no official recommendation yet, but kind of the general consensus is to stop the medication a week before that procedure. Otherwise, there might be food in the stomach, and that's a risk to patients to potentially aspirate where the food can come up and into the lungs, so.
Just project, okay?
Yes.
No, but I'm serious. The difference between having food in your stomach for a day or two versus for a week or two. I'd like you to give me your perspective on how you think that's going to affect our microbiome.
I think it's interesting because, one of the hypotheses, no one really knows why colorectal cancer necessarily develops, but one hypothesis of very many is that some people, can develop sometimes when the toxins or pathogens within our stool aren't being excreted quite as quickly, they can lead to, changes in the colon. So if we're slowing the gut down, we may see, some impact in that way, but we just don't know yet. And I don't want to mislead anyone.
You had a question like that? You still have it, or?
Sure. Well, I haven't had the chance to read your book, but I'm curious, is there any information about women's health and the gut? Because there's a lot of confusion. You're on your period, you might experience diarrhea. Some people talk about explosive moments on the toilet. Could you shed some light? I'm not speaking about me, I'm just saying.
It's for
so I do cover that a bit in the book. There's a lot of overlap, right? There's a lot of conditions like endometriosis that it can lead to abdominal pain, and the presenting symptoms, lead people to come see a gastroenterologist, but then ultimately are, other types of conditions. There's also a lot of misconceptions around, ability to poop and whatnot after pregnancy and whatnot. So it is covered in the book, but yes, it's a whole area of study. And actually, to be honest with you, there's still not enough studies being done in this space, and very few centers that are actually devoted to kind of women's gut health. So I think it's an important area.
And I'll get to your question in just a second. I want to ask him a couple of things here, but looking at the myths again and kind of focusing on that, a couple of things that I always hear from people is, I shouldn't eat and then go straight swimming.
What's the reasoning behind that?
It's going to get stomach cramps, and I'm going to pass out and die.
Okay. I don't think that there's any truth behind that.
Excellent.
But I can't guarantee that people are going to feel great when they do that. It's just like when you do any sort of physical activity after eating, especially because, to a certain extent, the blood is being diverted to your gut to help with digestion. So I can understand that there may be some impact there.
So it might not be dangerous, but might not be comfortable either.
Yeah, and it's probably not just restricted to swimming. It's probably any sort of physical activity.
How about eating before bedtime?
Eating before bedtime, so it depends. I would say, especially for people who have acid reflux, not a great idea, just because, again, the stomach is there in your stomach. You're lying down. It's prone to come up. So I would definitely not recommend that.
And then my last myth, we've all seen the commercial, squatty potty.
Oh, I love it. and this is not an endorsement for squatty potty, not sponsored or anything, but any sort of footstool. Actually, there's a graphic in the book where when you elevate your legs, if your knees are above a 90-degree angle, it actually positions the muscles in a way that there's a kind of this sling around your rectum that gets positioned in a way that actually allows the stool to come out. So there's truth to that. Yes.
And I have the Dr. John Torres squatty potties on sale. You okay? We take a few more questions back here.
How about intermittent fasting? Is it good for you?
Yeah, that's a great question. There's, again, not to be disappointing with the evidence here, but there's really not much conclusive evidence about whether or not it's beneficial or not. And it depends on what your goals are, right? If you're talking about like holistically from a health perspective, again, not enough evidence. From a weight loss perspective, it really depends. There's some people I see who adopt intermittent fasting, but take it as kind of a ticket, like a free license to eat whatever they want in the periods that they're not fasting, and that's definitely not the recommendation either, so it depends.
Yes, sir.
Yes.
Another myth might be taking antibiotics at the first sign of an upper respiratory infection without understanding the implication on antibiotic resistance as well as the microbiome.
Absolutely. I mean, it's never a good idea because, you know, some of these upper respiratory infections are viral in nature and not bacterial. And mind you, if a doctor is recommending that you take an antibiotic for whatever reason, you need to complete the entire course of it, because if you don't complete the course of it, even if you're feeling better, it could potentially lead to antibiotic resistance. And you know, on the topic of, you know, we were talking about probiotics and whatnot and the gut microbiome. You know, antibiotics, obviously, antibiotic means that it's there to kill bacteria. And so, you know, your gut microbiome can definitely be affected by that. So there are certain recommendations. One of the recommendations is for probiotics is actually that if you are on a course of antibiotics, that you could potentially benefit from taking a probiotic.
Is there a difference between probiotics and yogurt, let's say?
Yeah, so it depends, like what kind of yogurt it is. You know, you have to make sure, you know, the true definition of a probiotic, you have to have enough live, active, you know, cultures for it to qualify. So not all yogurt is a probiotic, but yeah, there are some that are. Yeah.
Excellent. Yes, ma'am?
What about the companies that advertise, you know, you send them some of your personal
Oh.
samples and they have perfect, you know, regulated for you supplements.
Yeah.
So it's not one size fit all. Is there any basis for that, to do that?
And
And
there's
the second
yes.
follow-up to that is, you know, I've been reading a lot about full body MRIs as a diagnostic tool. Does that have value in your field?
Great questions. First of all, about at-home testing. For any reason, I think a lot of these at-home tests, the challenge that we face is that we don't actually know as physicians what to do with that information. And especially like if they're using that and saying that you can actually have personalized, tailored treatment, you know, because with those results, I would proceed with a lot of caution there. With the full body MRIs, I don't recommend full body MRIs. I think what ends up happening is that there are a lot of incidental things that may not actually be harmful that are getting picked up when you're getting full body scans. And what that, you know, from my perspective, I see a lot of people end up getting additional unnecessary tests that are actually putting them at in other forms of risk because of those full body MRIs. So I wouldn't necessarily get one of those either.
I have a question about fermented foods.
Yes.
And also, what are prebiotics?
Yes. So fermented foods, you know, basically can promote the growth of these, you know, live bacterial cultures. And so kefir, sauerkraut, kimchi, all the foods that you didn't want me to mention, you know, those qualify as, you know, sources of probiotics. But prebiotics are basically forms of fiber that help feed basically the bacteria. And not all fiber is considered a prebiotic, but all prebiotics are considered fiber. So you just have to be careful. But again, our understanding of like what type of prebiotic to use to optimize, you know, your gut microbiome is still totally up in the air. So all we can say is that you should, you know, have a diet rich in, you know, natural sources of fiber to help fuel your gut microbiome.
Gentleman in the back here.
I'm a primary care physician. So talking about antibiotic resistance, et cetera, C. diff, we have treatments, you know, and fecal transplant, which you may want to talk about. We also have this wellness industry that in my area where I practice, there's a lot of individuals that will go for enemas, colonics, these types of things. If you want to speak to myths or
Yes.
The positives, negatives, the dangers.
I love all these
etc.
questions because these are all literally, questions that I get asked a lot on social media and that have ended up in the book. So there's no reason to get a colonic or colonic hydrotherapy. Your colon works by pushing stuff out on its own. And so just because you rinse it out once doesn't mean that there's not more poop that's going to come through. So it's not it's not a cleanse, it's not an effective method of weight loss, because some people, get one of these and they're like, oh, I lost 20 pounds in one session.
Yes,
well,
you did.
You were going to get rid of that weight anyways by going to the bathroom, yes. And but on the topic of antibiotics, so one of the most feared complications of being on antibiotics is C. diff infection. So it's a bacterial infection, very, very common, and often difficult to treat. It can keep coming back and back. And so one of the methods actually of treating C. diff infection, recurrent C. diff infection, I should say not treating it, preventing recurrent C. diff infection, is fecal transplantation. So what that means is basically, if you put the words together, it's transplanting poop from one person to another. And previously, just rewind even 10 years ago, is a very crude process. You would phone a friend and get their poop, and someone would basically do a colonoscopy and blend up the poop and then put it back in. And miraculously, we would actually see that it would repopulate the gut with healthy bacteria, and it would prevent people from getting this sort of C. diff infection that they got because of antibiotic treatment in the first place. Over and over again. So now things have become much more elegant. We went actually maybe 5 years ago, what was common practice was that there are these stool banks that actually have donors come in, provide their stool. They actually screen the donors and process the stool samples.
Do they pay for that?
Yes, they do, actually. And then now there's actually 2 FDA-approved fecal kind of transplant solutions. One is still colonoscopy delivered, and another one is capsule-based. So basically the poop is in capsules, and you take it orally, and it works that way. So it actually prevents the procedure. Yeah.
Talking to gastroenterologist, it is a wonderful.
It's actually a game
changer.
Game changer for sure. So. Yeah.
Also in primary care, a lot of my patients are very interested in toxins and want to hear all about cleanses, kind of from the whole top to bottom. What are your thoughts on those?
Oh, they're never a great idea. I feel like, our body often has its own ways of cleansing things. And so when things are marketed by, who doesn't like the sound of a cleanse, the idea of a cleanse? And so I see this being marketed sometimes by other physicians, unfortunately, like liver cleanses and things like that, that really have no utility at all. So I really think it's a waste of money, to be honest.
Ma'am.
That you should, do your business and then get out. Don't sit on the toilet. I know people who, do crossword puzzles and are reading.
Yes,
no,
scroll on social
no,
media.
That you should not be
Did my wife talk to you?
That it's, that you should just, not be sitting for a long period of time and, read your phone and, is that...
That's 100% true, so stop doing that, John.
I'll do the mini crosswords.
Oh, okay. Mini crosswords are fast. Those are like 20-second games. But yes, absolutely, because, it could potentially lead to hemorrhoids and other things that develop just from, being seated in that position for too long. So, yeah, I would also recommend just getting in and getting out.
Getting in, using the squatty potty.
Yeah.
All right, gotcha.
Exactly. All right. And if your poops are smooth, and you're eating a well-balanced diet, then it should be an easy process. And if it's not, then maybe you should see someone about it.
What's your take on water? Should we still be drinking 8 glasses of water a day for good gut health?
Yeah, it's definitely not the recommendation anymore, I'd say, that you have to force yourself to drink 8 glasses of water, 64 ounces or whatever it was.
And does everybody know where that came from, that 8 glasses of water? So it came from a study years ago, not a study, where an expert was talking about this and said basically you need 8 glasses of water a day, the equivalent of 8 glasses, but he also included in that 8 glasses the food you eat. your food has water in it. And so he's saying the 8 glasses is everything you consume should have 8 glasses equivalents of water during the day. Somehow that turned into 8 glasses.
Yeah. So there's no clear number. In some ways, our bodies regulate ourselves. If your body is telling you that you need more water, that's what thirst is there for. You know, it's actually, and that's actually, you know, these are driven by, you know, hormones that actually are there to regulate, you know, our bodies in that way. So it's not, there's actually a biological mechanism behind this. It's not, thirst isn't just a magical, you know, magical sensation.
And I get this question all the time, and what I tell people and my patients is the best way to tell, as gross as it sounds, we're on this topic anyway, so, is looking at your urine. If it's a pale yellow, you're hydrated. You're exactly where you need to be. And so that's how you can tell how much water you need. Yeah, exactly. Exactly. Yes, ma'am.
So I'm an orthopedic surgeon, so I'm in medicine, but I think it drives, I'm also a mom to 3 kids. It drives me nuts, this crazy, everybody carries this water bottle thing. So back to your, because I grew up, I mean, I'm I guess a Gen Xer, and we drank water from the hose. And so I want to know, like, and you know, the dirty water fountains at school. So like, what, all these kids that were just like, you have to have your water bottle, you have to have your water bottle, like, are we creating an issue there just because now we're overhydrating, or maybe we're triggering some sensors in our head? I'm just a simple bone doc, so that's my question.
No, I wouldn't say so. I don't think from that perspective that it's a problem. I thought where you were going from there was like, oh, is it the plastics within the bottle and whatnot? That's a whole nother conversation that we don't know much about, but you know, who knows? Maybe we'll find out whether or not, from that perspective, if it's a good idea or not.
Exactly, and one of the things I would bring up personally is that my own perspective, part of it's the modeling too, because you see a lot of adults walking around with the bottles as well, and kids see that and they're like, oh, we'll do that too, we'll pick it up, and it becomes very trendy at that point.
Very trendy.
Yeah. Right here. Hand up,
Can you tell us about this at-home test called GI mapping by Genova?
I don't know a ton about in detail about that, but I would just say that, again, to the point about the at-home test type of question, often they're testing, you know, if it's like mapping out your gut microbiome or like what your, you know, risk factors are for certain gut health conditions. We don't know kind of what, often the validity of like how that test was developed is questionable, but also again, the output of those tests, we don't quite know what to do with either. So, you know, I think maybe one day as we mature in this area, we'll be able to harness that information better.
Somebody has a mic back here?
Yes. So one of the big ideas this weekend is about worms and parasites and the small molecules related to those with gut health, or not gut health, but autoimmune diseases and allergies. What do you think about the potential of parasites and the molecules derived from them as gut therapies and autoimmune therapies?
Yeah, I think, you know, again, I don't, to be quite honest, don't know a ton in that area, but I think it's really interesting, you know, whether or not it's from parasites, just isolating molecules from nature, I think would be a great idea if we can identify that there's actual clinical benefit from it. So there's a lot of work that needs to be done in order to, you know, demonstrate that that's actually helpful, but I'm all for it if it is, you know.
Another question back there?
Thanks. How do you feel about activated charcoal for food poisoning?
Oh, for food poisoning, I don't think it's that helpful because, well, I think activated charcoal, like to get people to basically vomit it back out, I think it should be reserved for very specific conditions, and I don't think food poisoning is necessarily one of them.
So there's an ongoing debate in our house about the use of Tums after taking like Advil or Tylenol or something like that. I don't take it that often, so I say no if I'm taking it once a month, like I don't need to, but am I right or is my husband right? And he's not here, so
I don't think that you need to take Tums after taking an Advil or Tylenol, and it really depends because again, Advil and Tylenol are very different medications. Tylenol really doesn't have any effect on the gut lining. Advil, taken over time, you know, repeatedly, regularly, will actually, you know, block off some of the protective mechanisms for the gut lining and lead to, gastric ulcers and things like that that develop in the stomach. But, if it's just a one-off thing here or there, then I wouldn't say Tums is necessary.
Other questions way in the back?
What are you telling people about alcohol and gut?
Oh, this question.
Yes. Asking for a friend, yeah.
I mean, this is, I don't want to say controversial, but it's tough because, again, if we think about the gut as a whole, it's not just the intestines, but it's also the liver, and we all know what alcohol does to the liver, especially when consumed regularly in large amounts. You develop scarring in the liver, cirrhosis. It's not a good situation. And alcohol actually can put you at risk for a lot of other different conditions that we see in the gut, like pancreatitis, with acid reflux, things like that. So, obviously, I would like everything I say about diet in moderation, but if you can avoid it, then why not?
And way in the back here again.
I'm just curious, you mentioned the average age of colorectal cancer has been declining over time, and recently USPSTF changed the recommendation from 50 to 45. Do you think that's appropriate? Do you think we'll see it come down further in the future? And what should younger adults be looking for?
Yeah, I think that's a great question. I think that it potentially could come down even more, but all these public health recommendations are weighing the resources that are available. If we're asking everyone between 40 to 45, for instance, to get screened, that's a huge, burden on, the healthcare system. We already don't have, there's already a huge backlog on colonoscopies right now. So how do we accommodate that? But I do think that, there may be some sort of change in the future if we continue to see, these rates rising at the rate they are.
And then right next to you, you've been holding your hand up.
Oh, and I forgot to answer the second half of that question about what you should do when you're young. So again, aside from avoiding red meats and certain other risk factors that we know can potentially increase your risk of colorectal cancer, also a lot of the symptoms that people may dismiss, like blood in their stool or abdominal pain or unintentional weight loss, we've seen time after time people going to their doctors and being told, oh, it's just hemorrhoids or it's something else. I would encourage people if that's what if those symptoms don't go away, that you should get another opinion. You should really advocate for yourself.
And like most things, the earlier it's detected, the easier it is to treat.
Yeah, a dear friend of mine, she was behind the whole Ryan Reynolds getting his colonoscopy video, and she publicly talks about how she went to see her doctor. She was diagnosed in her 30s and was basically dismissed, saying that you just have hemorrhoids, don't worry about it, but the problem just wouldn't go away, and she had to advocate for herself in order to get a colonoscopy done.
Great. Is there an optimal poop consistency, color? Sorry. And is it okay for it to change, like over the week, over the month?
Yeah,
Curious.
it's absolutely okay for it to change because it's so diet dependent. Depending on what none of us are eating the same meal, every single day. So we should expect changes here and there. But even our definition of what's normal is kind of vague. We sort of say that as long as it's between 3 times a day and every 3 days, that's considered normal, and everything outside of that, maybe you should get checked out, but it really varies from person to person. So when people are telling me, I didn't have a bowel movement today, I only have a bowel movement every 2 days and I'm scared, I help reassure them and say that,
And can that change?
Absolutely, yeah.
Where it might be every day, it might be every 2 days, go back to every day.
Totally, and it depends on, your food intake, your water intake, where you are geographically, the climate, whatnot. Like here we are in Aspen. I'm feeling very dehydrated. So I think it really depends.
Sorry, just to add on, I heard that it needs to be like one long piece and fall all even.
Oh, no. It definitely doesn't have to be, yeah. Actually, there's a whole chart. We have a Bristol stool scale that kind of, I've actually made a TikTok about this a while back where, from one end of the spectrum, there's like the rock hard pebbles. And actually, this is kind of gross, but I ate Maltesers to demonstrate that's the consistency versus chocolate milk is on the other side of the spectrum. So you kind of want to be somewhere in between, but it doesn't necessarily have to look like a log. or it doesn't have to look like, you know, chunks or anything like that. But yeah, it can vary.
A couple more really quick questions. You and right here.
I love that though.
Sure. So I just want to go back to the safety of the do-it-yourself fecal transplants. I am the Open Biome, which we are the largest stool bank in the country, in the world. But can you just explain, because I think it's really important for people to understand, because of TikTok and there are all these different movies showing how people were calling a friend and getting some stool, oh, you look healthy, why that's really dangerous, and explain what can get transferred if they're not getting highly screened, regulated stool samples.
Yeah, please don't take someone's stool and try to self-administer that at home. Yeah, I mean, there are a lot of transmissible diseases and infectious diseases that are screened for by the stool banks that actually provide, you know, the stool for fecal transplant. And there's other things that we might not know about, right? Like, and people, the donors even, like they may have other family histories that are taken into account, you know, during the screening process that, you know, if you're just phoning a friend or your neighbor, you might not, you know, actually take that into account. Yeah. And it's
how well do you know them, I guess, is the bottom line. Last question.
I was curious about long-term use of protonics. It seems like the doctors in this country seem to be overusing protonics. So
absolutely. And that's the thing, is like a lot of these, what's protonic? So the question was basically, you know, what my opinion was about long-term use of protonics. So protonics falls into this category of medications called proton pump inhibitors, PPIs. A lot over the counter, like I said, Nexium, Prevacid, Prilosec, these are all in the same family medications. And often people are on these medications lifelong when they shouldn't be. And so, you know, often these medications are prescribed for acid reflux or, you know, other types of conditions. And taken long-term can lead to, you know, diarrhea, osteoporosis. There are, you know, kind of demonstrated adverse effects of these medications when taken long-term. There's also a lot of misinformation out there, though. There's a lot about like kidney, the effects on the kidneys or dementia. Those claims we don't quite know about, even though there's a lot of press around that. But again, the goal should be to be on these medications only for a certain amount of time and then off of them if possible. There are, you know, there are certain patients that we come across who have some conditions that have not resolved. They need to remain on those medications, but that's the whole thing about weighing the risks and benefits. That needs to be a conversation with the doctor. Yeah.
Great. This has been a fantastic conversation. Thank you for all your questions.
Thank you so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.